Ended up over 240 kgs. Huge. My frame, my physical frame, was too heavy to stand or sit or lie down. I couldn't fit on a bus. I couldn't fit through a car door. For almost 20 years I've been unable to walk. My hips had disintegrated on both sides. My skeletal frame was breaking apart. If I was to sit down like this, I couldn't see my knees or below my knees because my puku would bellow out and over and cover me. If I didn't change, I'd be dead, easily.
A health coach can support reversing or managing those disorders such as diabetes, CVD, high blood pressure, lipidemia, and other health concerns, and do one-on-one support, and then working out a plan, a routine, or something to build good quality habits that are going to give you benefit and quality of lifestyle. Kai hei rongoa, so kai is our medicine, sleep is medicine, breathing is medicine, exercise is medicine. These are all things that we can add into our lifestyle. Other examples, we've had whānau go from weights of like 260 kilos, 250 kilos, and have lost all this weight and gone down to 86 to 90 kilos. And in that process of losing all that weight, they've been able to reduce inflammation in their body where their legs were sore. Whānau that couldn't even put shoes on because their feet were swollen, now their feet are no longer swollen and they can wear shoes.
And then I had to train myself how to walk. I was falling down everywhere, tripping over because those muscles weren't working. The ability to sleep better, sleep deeper, sleep longer, no snoring. Well, at least no one's told me I'm snoring like I used to, Jared.
Improved sleep quality, breathing easily, and reducing total medications. And when I say this, talking from 15 medications down to 2 medications, down to 0 medications.
In running a household, I can now do. I can stand at my sink and wash dishes. I could never do that before. I can hang up my washing. And I'm talking about over a 20-year period of being unable to take care of my family, and that is all because the weight loss through the knowledge of how to live and eat low carb has allowed me to come to this point.
These things are noticed not just by yourself, but the people that are around us. Whānau start to notice the change and the benefits that they also get. These benefits are not just for ourselves, but they also have an impact on our whānau and community.
It took a lot of work. But because I'm the cook, you have to eat what I cook. I did that for the whole family. Eating with family can be difficult for a lot of people. That's why keto, carnivore, low carb fasting works in those situations.
But ultimately, these things are going to help support reversing metabolic disorders and other illnesses, and with the hope to get off the need for medications and live a happy quality life.
I've been into a few hospitals and they still have the food pyramid the way it was originally. Are you kidding me? That's not right. I've pulled them down, taken them away. No, that's not good enough. If they threw all that out and the sugar and just ate what they used to from the sea, on the land, in the air, bang, perfect. Our tupuna, they had it all along. What I see that our people need is a good team around them. If you can get this team around you and find a GP clinic that's on the same wavelength and understand, and get a health professional to understand and give you the support and give you a direction and say, start simple, don't worry about all that fancy stuff.
We have all these services that we can utilise within Tūriki as wraparound services that will ultimately help whānau to create a better environment for them to achieve their own greatness.
You know, our people, they don't really care what you know. They just need to know that you care.
We have whānau that have ultimately changed their lives and changed the surroundings around them, and now they're living a really high quality lifestyle.
You've really got nothing to lose. If you've been doing it this way all the time and you're still unwell, something needs to change. Please forgive me, I hope you don't mind that I am not standing. I suffer from grandchildren, we call that mokopuna-itis. I had them the last 5 days, and Lily Fraser can tell you that's been my dream for the last 20 odd years, to be able to play with my mokopuna. And I've done that, and I'm suffering now. I can hardly walk, my back is given out, but to hear those words, Nanny, right? Nanny, pick me up. Nanny, play with me. I mean, I never thought, ever, that God will give me that opportunity. And because of the change in my lifestyle, from the way we were living and eating, you know, the things they taught us back in those days, white is best, white sugar, white flour, white rice, right? Are you kidding me? It's no wonder I was 260 kgs at such a young age. As soon as I discovered low carb eating, within fast, really fast, unbelievably fast, changes started happening, things started falling off, right? And the one big problem, I couldn't find any medical health professional with the nutritional knowledge. So I'm talking quite recently, less than 10 years ago, in Auckland, the biggest city with the big medical school, right? Do they teach doctors nutritional health? Absolutely not. They have no idea. So no wonder I carried that weight around all this time. And so I looked, Heart Foundation, nothing. Diabetes Association, nothing. The hospitals, what? Breakfast, white bread, white sugar, white porridge, breakfast, and you've ticked diabetic. I mean, then a yogurt with fruit, sweetened yogurt. You know, we can laugh about it now, but I was spewing back then. You know, take it away. Don't bring that, it says diabetic. Take that away. I had my family cook and bring my own kai to me. So, even my own GP knew nothing. I had to do my research myself. My daughter came across an article, I was almost dead. And we read it together, we reread it, and we read it again, and we said, what? Surely it's not as easy as that. Not as simple as that. You mean what you eat and what your body does, and then what you don't eat and what your body does. How come no one told me? And then, like many people I heard here, I was led to a GP in Tūruki Health by the name of Lily Fraser, who had been running a low-carb support group for maybe 2 years before I got there. And I had no idea, and she was the only one, just her, in the heart of South Auckland, right? That's where we come from, the big people, you know, and she was there. So I grabbed hold of her and I've never let her go since. Because she had the knowledge, the nutritional knowledge. So just a couple of things for your patients and for the coaches and your GPs, whoever's there. Tell them keep it simple, because it is simple. It's not hard. It is simple, right? Eat deliciously. Eat when you're hungry. Stop when you're not. And when you eat deliciously, low carb, healthy fat, because fat's your friend, right? Low carb, healthy fat, eat the lovely meals. Is that okay? Yeah. Reverberating. Eat those lovely meals, and your period, the time between meals, extends and get longer and longer, and all of a sudden, guess what? You're fasting. Boy, that's the winner there, right? Low carb and fasting, right? Your body's renewing, rebuilding, recycling, everything, resting, and you start to look younger. Okay, that's what everyone told me. So anyway, I'm open to questions if you have any when the time is ready. Thanks, everybody.
My name's Estelle. I'm actually a registered nurse trained at Green Lane Hospital. My first diet ever was the Green Lane Hospital diet, which was given to all of the heart patients, which was a boiled cabbage and 3 onions and a big pot of water, and that's all you drank and ate for 3 days. Yuck. And I've been on every other diet I can think about. I have to say I'm probably the only one in the world who's been asked to leave Weight Watchers after gaining weight on their very strict diet for 5 weeks. When I got married at 20, I was 98 kilos. I've been a long distance swimmer all my life, so I've always been forced to eat carbs because you needed it. And after having 2 children, it hovered up there around the 120, and I ended up with my wonderful GP doing his annual review. Marcus, thank you very much, I owe it to you. He kept doing my blood tests, and I became a type 2 diabetic. Medication was my enemy, gave me purging diarrhea, and eventually I was on Lantus, so the insulin, and I hated it. And one day I went there for my checkup, and of course he weighed me, and you've put on weight. And then he picked up this big bottle of water and said, pick up 2 of those, that's what you need to lose. And I thought, oh my God. And he said, how do you want to do it? We can help. And he handed me a leaflet of photocopied pages all about keto and a website to go and look at, and we talked briefly about it. And I said, well, I will try. I was a creature of habit and always had wheat Bix bites for my breakfast, because I'd always had wheat Bix, because that's what Mum said. So I had to get rid of that addiction first and break that habit. And I said I'd give it a week. And I managed to do it, because on the website and on the videos it said I could have strawberries and whipped cream for breakfast. My God, oh heaven. And I did that every day. And at the end of a week, I went back to Marcus and he weighed me, but he wouldn't tell me what I was. But he had a smile on his face. So I said, okay, I'll do it for the rest of the 3 weeks of the month. I said I would give it a try. I am a creature of habit. I am strict, I'm pedantic, and if I'm going to do it, I'm going to do it on my own. So I decided that I had to do it. He offered me a health coach, and I said, no, I can do this. And so I did, and at the end of 4 weeks, I had lost 9 kilos. Oh my. So then I started reading everything I could find, and in the first 4 weeks, not a drop of sugar passed my lips. Not anything that had sugar in it. And I read every single label, and I looked at the carb value. Sometimes carb values are low, but the sugar content's high, because they've got to fake it somehow. And so I wrote down everything I ate and every single value. And my sugars came down. And it was some weeks later, a couple of months later, as the Lantus kept getting reduced and reduced and reduced, that we stopped Lantus. And today, I'm not a diabetic. Yay! So, for me, when I was talking earlier, the most important things that I believe, if you're going to want to lose weight, is that you commit to it Commit fully. Nobody else needs to do it for you. You have to make that decision that I'm going to make the change and I'm going to do it my way. Okay? You can't do it because somebody says. You have to plan. And for me, even today, I plan my week's meals. You plan it. If you don't plan it, you stop at McDonald's or you buy fish and chips. I haven't had a takeaway in 2.5 years. They're doing without money because I'm not spending it. Then you must read every label of every single thing. And people must hate me in the supermarkets because nothing goes in my trolley till I've read it. Do you know, if you're buying blue milk, look at the different brands. The sugar content differs, as does the carb value. And it's better to have blue milk than light blue milk. So read the labels. And make sure, if you're cooking, that you read your labels of things like your soy sauce and your chili sauce and the this sauce and the that sauce. Because sometimes just having 4 or 5 sauces can take you nearly halfway through a 20 carb daily diet. Make sure you read your labels. And preparation. Make sure you've planned it and prepared it. I have a little tip. My son lives in Australia and he thought I was crazy, and then he saw something on the internet, so he sent it to me. And it's preparation. So if I'm going to make a crock pot, I get all of the ingredients and I put it in a large Ziploc bag and I freeze it flat. And then you stand them up on their edge so that you've got a row of whole meals ready to throw into your crock pot or your casserole dish. So when chicken's on a special, I buy a whole heap and I make maybe 10 of those packs and put them in the freezer. You know, when something else is on special, you do it and you put it in the freezer. I take it out in the morning. If I'm going to cook it on the stove, I take it out the night before if I'm going to put it in the crock pot in the morning. My planning. The best advice I have is keep it simple. The reason I became diabetic and the reason I became overweight was my addiction to certain foods. It was addictions through cakes and biscuits and Whittaker's peanut slabs. And then they damn well last year brought out an ice cream and I can't have it. And I'm not even going to have it for a treat because it's got too many carbs in it. Okay, so keep it simple. If you go on places like the internet and the Facebook pages, keto pages, you'll see all these people who are baking, who are making treats, who are doing chocolate this, who are making something that, who are cooking all these fabulous meals. All they are doing is replacing one addiction with another addiction. Keep it simple. Don't go outside that. I live on under 20 carbs a day. Most days it's about 17 or 18. I got down to my lowest at 81 kilos from 123. Christmas came, my birthday came, I went and stayed with my son in Australia, and I'm today 84. But it'll come off. I know how to do it, and it will just slip off as that. And my blood tests are all fine. Marcus is looking after me beautifully. He's a wonderful guy, and he knows exactly how to put it to you. He has these big bottles of water in his office. You've lost 2 of those, plus another one. So goodness me. All right, that's my story. Thank you for listening.
Ngami ki koutou katoa. I am running as Glen says. Excuse me, I am a smoker, so I'm a bit chesty at the moment, so I hope you can hear me clearly. And Jala, just like to meet to you if you're here. Kia ora Jala. And Jared, if you're here. Kia ora Jared. And Glen, they are 3 people who have been very instrumental in where I have been with type 2 diabetes. I'll bring it to today. Currently, I'm still a diabetic. My blood glucose reading was 53, and my ferritin, my liver, it is very high. So I do have fat on my liver. I am working through intermittent fasting, so twice a day, and kind of figuring out where keto was with me, low carb, and now how I'm going to shift this fat from myself, which I will be continuing on with you, Glenn. Now, I'm going to tell you my story. Hopefully, I'll fit it in 10 minutes. But, I was 150 kg. I was type 2 diabetes, and this was back at the time of you, Miriam, where doctors just did give you the medication. You were there for 2 or 3 minutes, maybe 5 if you were lucky, and then you're out the door and you're walking out confused. You really don't know anything. So my weight had gone to 150 kg. I'd gone back, I whakapapa from Taupo to Wharetoa, and I had gone back to Taupo, and my brother was absolutely not happy with me at all because of my weight. Our urupa was just up the hill of Mairoa here where I live in Taupo, and he says to me, if you don't do something about yourself, you're going to be in a box and we're going to be walking you up that hill. So I live in Mangere, and I have done for the last 46 years. I did come back to Mangere, and I did start to change my eating habits. So I had lost, I think, 49 kg. But still on medication. During COVID, I had got a burn on my, anyway, and it was only a slight burn. But anyway, because of COVID, eating chocolates, ice cream, everything sugar, forgetting that I was diabetic, that burn that I had turned into quite a serious staph infection that I could not feel. I mean, I couldn't feel it. At the time, our doctors were all shut down. Ended up going to Otahuhu to, I think, I forgot the name actually, sorry. But first thing the emergency doctor says to me was, are you diabetic? Because the infection was actually started from the back of my leg and it was growing quite quickly. And then I found myself in Minimal Hospital on the operating table, and they'd given me the gas and removing the infection from my 3-degree burn that I had, that had happened. So I have a niece, Serona of Armica. She had full-blown cancer, but she married my nephew, and I knew everything that Serona was doing with keto. So, because of that knowledge, my nephew, Serona's husband, said, Auntie, you can reverse your diabetes by doing keto. So when I was in Middlemore Hospital, I wasn't eating the food from the hospital. I was going downstairs and I was just getting salads. And because I was aware of what the keto diet was all about. So that's when I got into eating keto. And the results in the hospital from my meds, everything was coming back into normal with being on meds. I then was back at work and I was lost. I kind of didn't know what to do because I didn't want to bother my niece and my nephew. You know, what do I do now? Kind of thing. Anyway, so I said, Coke here. And that same day, my niece had phoned me, Serona, to ask if I would go and do a trial that Glen was doing with our iwi, NZ reversal. So I said yes, and then I was introduced to Glen, Jala, and Jared, and it was another journey that I went down. But at the same time, which was quite successful for me in what I was able to learn from these three. And then the trial ended, and then I was back on my own again and lost again, really, because I'd handed in my resignation from work, and now I was in a place where I didn't really expect to be. Looking forward to retirement, but now not going to be in that place. So my mental health was affected. Today, 2024, it was the best thing I could have done for myself in moving out of healthcare. And as you as healthcare workers, you know what staffing and all of that, how that all was during the COVID, and still pretty much the same today. I'm retired. I'm doing gardens. I'm looking at going back to work part-time, and then I've also re-signed up the trial that we did with Glen and Waimihia was successful, so now processes are in place for the rest of my iwi to be able to help themselves, really, because Māori won't shift. That's it. Oh gosh, you're looking good. You know, what have you been doing? And then telling them about what the program is with Glen. You know, they just don't. Though they will with the new programs like you guys are doing and how you're out there helping. So, yeah, thank you.
Is there anything that, as a healthcare professional, someone could have done to make the role, make your job easier?
Have the knowledge.
So the answer was have the knowledge. Any other?
Can I ask do all of you fast?
Yes.
So the question was, do all of you fast?
Yes.
So, Rangi, you're doing intermittent fasting?
I am. With the fatty liver that I have, intermittent fasting is what I believe is the way to go. And then, of course, I'll do some coaching with Jala and Jared to help me along those lines. But yes, intermittent fasting, 8:30 to 6 o'clock at night, and then say 6:30 to 8:30 in the morning, which is my medication time. It's fasting in between.
No, I don't fast. I eat when I'm hungry, but I live by my mother's mantra. I always eat breakfast, but I make my own keto porridge. People say keto's expensive. It's not. It's 33 cents a meal, it works out. I bulk buy it. I make it out into a 3 to 4 serving, put it in a Ziploc bag, and then I make it every 3 or 4 days. And that's how I do it. But I've also talked about the staff at work. I still work at St John, and they have massive meal days. They celebrate everything with food. And all the girls were getting rather large, and they said to me in November, "Gosh, you've lost weight. How did you do it?" We had a food day the other day, and they did a shared, what was used to be a lunch. It was a brunch, and it was scrambled egg, and it was bacon, and it was the porridge, and it was berries and whipped cream. And they are all helping each other. And some of them now have lost enormous amount of weight. One of the girls has lost so much that she's been able to become pregnant. And they are talking, we don't need a health coach, I guess I'm the unpaid one, but we conversation about it. They had tried fasting. I say, I don't fast. I eat when I'm hungry after having breakfast. The keto porridge fills you up well, and usually I take a couple of hard-boiled eggs to work, or I poach eggs at work, or I have a salad, or I don't.
One of the themes I see emerging is this ripple effect, isn't it? Where you drop the stone into the middle of a quiet pond and the ripples move out. And that's an amazing example of how you're an unpaid health coach. But I'm expecting that you're a very good health coach, because
It's about getting them to commit. They have to make that decision. You can only be their support.
fasting.
Yes, I fast 3 days, 7 days, and my the longest time I've fasted is 21 days.
Wow.
So yes, I do fast.
The main attraction I came here today was Marianne. Lily and I went to med school with her son, and she's a formidable woman. So this, I think the biggest lesson for all the health carers in this room is that we need to learn from them and put our fucking egos aside. You're out there in the community constantly being told that you have to be the doctor, ignoring what our people are finding for themselves works for them, and ignoring that they have knowledge of their own tinana. Look at our wahine out there, our wahine rangatira, and they are the leaders. I said to Marianne, you need to speak at these things. She's like, why didn't they listen? I said, because you didn't run it off, did you? It was your kai. You are absolute proof that it's not about running a marathon. It's about thinking about your kai and really being determined and committed to your health. So I'm so grateful to Alfaya and Alfaya for coming and sharing their story, because it is intimidating sitting in front of a room. But we need to be held accountable, because the reason why they are sitting there is because all these years we have blamed them for their health problems. We have dosed them up, and we have been the cause of why they sit here today. So, it takes a formidable woman to teach us from how we should be doing it and hold us accountable.
There's just one thing that I'd like to finish on. Rangi, when we've spoken on the phone, you talked about not feeling judged. Do you remember that comment? Would you be happy to share something?
In reference with my smoking.
So, right.
And Glen actually says to me, what did you say?
Right, Rangi made the comment to me that not one of the health coaches that she'd spoken to had judged her negatively for smoking, and I think that's really special, because I think that would be very, very unusual for somebody not to have a judgment, whether it's spoken or unspoken, about that. Not one of the health coaches had made Rangi feel that she was judged negatively or any other way for that, and that was the one thing where I went, yeah, there's really something in the health coach approach where you don't judge.
Because it was very much happening in the public sector. Smoking. So no, stop smoking and everything will be well. Well, I have given up smoking, but inflammation wasn't well. You know, for the year and a half that I was still feeling the same effects. So,
It's yeah. So the fact is, health coaches, we don't judge. We accept that the client is the expert in their own health. You know, I think that's one of the really special parts about coaching. So we'll wrap up this session. As May says, it takes a lot of courage to stand up in front of a big room of people like this, but it also takes courage to share the stories that you've shared, because you've shared your challenges, and many of us don't understand those challenges from your point of view. So we are all incredibly grateful to you and humbled.